Okay, so imagine being 18 years old, in constant physical pain every single day, having a doctor tell you there's a real solution, and then your own parents say no. That's exactly what's happening here, and I have a lot of thoughts. So this comes from the subreddit r/relationship_advice, and the title is 18 female, want plastic surgery for chronic pain, but my parents are against it. And before you assume this is some teenager wanting a cosmetic procedure to change how she looks, stick with me because this story is so much more complicated than that. Here's the situation. Our narrator is 18 years old, 5'4", and she wears a 30H bra size. Now, if you're not familiar with bra sizing, let me put that in perspective. That is an extraordinarily large cup size for her frame. And she's been dealing with the physical consequences of that for years. We're talking about severe upper back pain. Bra strap grooving, which, if you don't know, is when your bra straps dig so deeply into your shoulders over time that they literally leave permanent indentations in your skin. Rashes. And she can no longer do cardio without being in pain. Just exercise.
Gone.
Because it hurts too much. And here's the part that really got me. She said that at one point, she developed disordered eating habits, trying to change her body. Because when you're a teenager in that much physical and emotional distress, and you feel like your own body is working against you, sometimes your mind goes to desperate places. That detail, right there, tells you how serious this has been for her. She's tried everything. Expensive, specialty bras, physical therapy, muscle relaxers. Over 2 years of seeking medical help and trying every non-surgical option first. This is not someone who woke up one morning and decided she wanted surgery on a whim. This is someone who has been suffering and methodically working through every other option available to her. Now here's where the family dynamic gets really interesting. Her mom, who is 47, is also larger chested. And she has attended most of her daughter's doctor appointments with her. So she's been there. She's seen the medical visits. She's heard the concerns. But here's the thing, the mom also experiences discomfort from her own breast size. And her approach? Just live with it. Don't make a big deal out of it. That's just how it is. And look, I get it. A lot of people from older generations were raised with that mentality. You push through. You don't complain. You certainly don't consider surgery. But the mom is also going one step further. She doesn't even believe that her daughter's breast size is the main cause of her pain. Even though a plastic surgeon has confirmed she is an ideal candidate for a reduction. Even after 2+ years of doctor's appointments. The dad, 59, agrees with the mom. So our narrator is sitting here at 18, an adult, legally, with a doctor's recommendation, a plan to pay for it, college fully funded for 4 years, and savings of her own. And she's asking the question, how do I make a medical decision for my own health when my parents strongly disagree? Let me be really clear about something. She is 18. She is legally an adult. She does not need her parents' permission to have this surgery. That is just a fact. But she's not asking about legal rights. She's asking about relationships. And that actually says a lot about who she is as a person. She's not trying to blow up her family. She's not being reckless. She's genuinely worried about damaging her relationship with her parents, even though she is the one in pain, even though she has done everything right, even though the medical establishment is on her side. And I think that tension is the heart of this whole story. Because on one hand, you have parents who clearly love their daughter and are probably coming from a place of protection, even if their reasoning is flawed. The mom, in particular, might even be projecting a little bit. She's normalized her own discomfort for so long that she genuinely can't see her daughter's situation as different or more severe. That's not malicious, but it is a problem. On the other hand, you have a young woman whose quality of life is being genuinely impacted. She's not able to exercise. She's having emotional breakdowns in fitting rooms. She developed disordered eating. She's in daily physical pain. And she has found a real, medically supported solution that she can afford. At what point does someone else's discomfort with your medical choices get to override your actual medical needs? Now, I don't want to completely dismiss the parents here, because I think there's one thing worth acknowledging. Anytime someone has surgery, any surgery, there are risks. General anesthesia, recovery time, potential complications. Maybe that fear is part of what's driving the parents' opposition, and they just aren't expressing it that way. But if that's the case, the conversation needs to shift. Because "I'm scared for you" is very different from "your pain isn't real" or "you don't need this." If I were giving advice here, and look, I'm just a narrator reading Reddit stories, so take this for what it's worth, I would say this to her. You have done everything right. You have been patient. You have sought medical help. You have tried alternatives. You have consulted a surgeon. You have secured the finances. You are 18. You are allowed to take care of your own body. Your parents' feelings about your surgery are valid. They get to feel whatever they feel. But their feelings do not cancel out your pain. And the fact that you are this concerned about their reaction shows that you are not making this decision carelessly. You are making it thoughtfully, out of necessity, after years of suffering. If the relationship takes a hit, that is hard. That is genuinely, heartbreakingly hard. But a loving relationship should be able to survive one disagreement, even a big one, especially when the person making the choice is doing so for their own health and well-being. And honestly, once her parents see her living without constant pain, once they see her able to exercise again and not crying in fitting rooms, I'd be willing to bet the dynamic shifts. It's easy to oppose something in the abstract. It's much harder to look at your kid thriving and say you were right to stand in the way of that. So, what would you have done in her position? Would you have gone ahead with the surgery? And what about the parents? Do you think they had any ground to stand on, or were they completely off base? Drop a comment below and let me know. These are exactly the kinds of stories I love to dig into. And if you're new here, subscribe for daily Reddit stories. I'll see you in the next one.